Hello, welcome to my applied project poster presentation. My name is Jennifer Morales. The title of my project is The Effectiveness of Discrete Child Training to Increase Sight Word Recognition in a Child with Autism Spectrum Disorder. The rationale for my research is that the participant lacks sight word recognition skills, which is affecting his reading fluency and comprehension. My research question is discrete child training an effective intervention for increasing sight word recognition? My participant is a 7-year-old boy named Jason in second grade with autism, and Jason is a pseudonym, and the setting was Jason's home. For social validity, increasing Jason's sight word recognition skills will improve his reading fluency and comprehension and allow him to access grade level reading material. Just a brief summary of previous research. Children who can read the 100 most common sight words have the foundation needed to read the majority of typical text. And current intervention programs frequently use discrete child training to help children with autism acquire new skills, which is why I chose discrete child training as my intervention. I used a changing criterion design. The baseline phase was followed by a series of 4 intervention phases, and each intervention phase had a changing criteria for the number of sight words read correctly. The independent variable was discrete child training, and the dependent variable was sight word recognition. For data collection, baseline data was collected for 4 sessions, and all those sessions occurred on the same day. The intervention data was collected for 16 sessions over 16 days, and data was always collected at the end of each session. During the baseline phase, the participant read a list of sight words with no prompting or feedback, and then there were 4 intervention phases, and the learner was taught 4 new words during each intervention phase using discrete child training. So first, a word was presented on an index card, and the participant was asked, "What's the word?" And then he was given an opportunity to respond, and then either reinforcement or correction was provided. Then the 4 new words were mixed with 6 known words into a pile of 10 words, and all those words were practiced 3 times using the same procedure. At the end of each session, the participant read the list of sight words with no prompting or feedback. And these are the results. So the behavior observed during both the baseline and intervention phases was the number of sight words read correctly. So during the baseline phase, the learner read 13 words correctly, and then during each intervention phase, the criteria increased by 4 words. So during intervention phase 1, the goal was 17 words. During intervention phase 2, the goal was 21 words. During intervention phase 3, the goal was 25. And for intervention phase 4, the goal was 29. And as you can see, the learner met the criteria for each intervention phase. So the results indicate that discrete child training increased sight word recognition. So again, the results of the study indicate that discrete child training is an effective intervention for increasing sight word recognition because the participant met the goal for each intervention phase. The implications of these findings are that discrete child training is an effective intervention for teaching children with autism new skills. And due to time constraints, a maintenance phase was not completed. So in the future, I would do a maintenance phase to check if the participant was able to retain the number of sight words read correctly after the intervention ended. And this is the references section. These are the sources that I used to gather the information for my poster. Thank you for watching.